Miren, de alguna manera vamos a seguir un poquito en la línea que ahora han escuchado.
We will continue now along the same lines, more or less, because we spoke about nursing homes, care homes. Ms. Rodriguez Yosune is the marketing director of Ballesol, and these care homes will be the protagonists over the next few minutes. I said earlier, where do we spend most of our time? At home, right? But when we reach a certain age, many people spend most of their time, almost all of their time, because they need care, because they need assistance, because they may be alone, because they need to be in a social context, and they spend time in care homes and nursing homes. And space considers these areas as well. Now, let's focus on active aging in care homes, cases and experiences. Let's welcome Dr. Fermín García, National Medical Director of the Ballesol Group, specialists in geriatrics. Fermín, welcome. You scared us earlier. Don't worry, I fully recovered. That was just a test. You know, I wanted to see how I could react, and I see I can still react, and I have my reflexes intact. Let's welcome also Ms. Maria Ballesol. She is one of the clients of the Ballesol care home in Badalona. There she is. Let's welcome her. No hurry, Maria. Take your time. Doctor will start. I think the doctor has a presentation to share with all of us. Yes, I'll give my presentation from here. You can take a chair if need be as well. You can use this pointer if you need it. So I'll leave you with Dr. Fermín García, a presentation about Ballesol. Good morning. Good morning to you all. I would like to thank OAFI Foundation and Dr. Josep Vergés for their invitation. And I hope that these words, these remarks, will be of assistance to highlighting the importance of the movement of active life, of active aging. In my brief presentation, I would like to assess two different situations. One is fragility and hip fracture. And I would like to emphasize how important it is to live an active life and control one's nutrition. We will be talking about muscle loss and the relationship with fragility and immobilism. We will also be referring to some studies we've carried out in our group, the Batlle Power study in cooperation with the CEU San Pablo University of Valencia. We were able to see how important it was to recover active life, to recover one's autonomy, and the role played by nutrition and exercise. We will be referring to the study on hip fracture in cooperation with La Paz Hospital, as well as the approach of hip fractures in elderly patients. And why is this important? Why is this movement important? Let's have a look at this slide. Mobility and active life are important because as of the age of 40, we start losing muscle. And this loss of muscle is so important that at the age of 80, we have lost half of the muscle mass we had when we were young. As you can see in this image of our musculoskeletal system, or the muscle system, not only is there a loss of muscle mass, but also a redistribution of the fat versus muscle behavior. Not only do we lose muscle, we also lose fat. And there is a redistribution of these two elements in our body. This means that bones turn more fragile. Bones maintain our architecture, our skeleton. So it is important to keep this in mind, because the consequences of this physiological situation are the ones we are all aware of: immobilism, fractures, dependency, and greater impairment. And this occurs physiologically, because when the loss of muscle tone is produced pathologically in geriatrics, is called sarcopenia, a syndrome, even more dangerous than physiological muscle loss, which occurs as a result of a reduction not only in muscle mass, but also in muscle strength and also physical performance. Sarcopenia, this term that comes from the Greek, was coined by Dr. Rosenberg in a convention held in Albuquerque on internal medicine, where they addressed geriatrics issues. This was in 1997. So for some years, we have known about this loss, this pathological loss of muscle tone, which is dramatic. And unless we act on it actively, it could lead to a progressive and fast impairment of the muscle system. Now let's focus on this slide. This is a study conducted in 2004 with two different groups, two groups of patients. One group with young people. This group was subject to 28 days of inactivity. The other group, formed by young patients, healthy patients, was subject. Apologies. The group on the left was the group of young patients with 28 days of inactivity, and the group on the right, elderly patients with 10 days of inactivity. So, under the same conditions, the same nutritional conditions, same basal conditions in the group of youngsters and elderly people, the group of elderly people lost 3 times more muscle mass in 3 times less the time. So what does aging depend on? What factors are involved? What factors can we focus on in this aging process? Up here, in these 3 images, we see 3 elderly people. Now let me ask you a question. Would you say that these 3 elderly people would be of the same age? When I asked students, when giving class, I made them think about it, and most times they used to say, yes, they could be of the same age. The person on the right could be younger than the person on the center. The aging process relatively depends on age. Age is inexorable. We will always age. But aging has different stages. From this strong-built elderly man, what the American called the robust elderly person, an independent person with good quality of life, with some acute disease, without impairment, without dependency. And from there, we move on to this one. This person, a dependent person with a functional impairment, advanced, where geriatric syndromes are amply developed and where a treatment is required, even palliative care. In between, we can see the person in the middle. This is the so-called fragile elderly person. This fragile patient will go from one situation to the other depending on a series of intrinsic factors such as genetic factors. Some families live for many years, but this is a minority. The most important thing is the lifestyle and nutrition. Moving from one stage to the other, from a robust and elderly person to a fragile one to a dependent one, depends a lot on our lifestyle, exercise, nutrition. And talking about lifestyle, we also need to refer to social relationships and the satisfaction for what we already have and not for what we do not have. And these, just underneath these 3 photographs, we can see the consequences of this move from robustness to dependency, which occurs as a result of a reduction in mobility that predisposes to increased falls, immobilism, and fractures, an impairment of the physical function, and increase in the vulnerability in the face of stressful situations such as admission into hospital, pneumonia, hip fracture. Complications are much greater in fragile patients because they already bear baggage, a diminished reserve, and they are in a basal situation in which there could be some compensation. But when there is a stressful situation, such as a hospital admission or a hip fracture because of pneumonia, then a series of mechanisms uncompensate the situation, unleashing a series of problems. Psychologists say so, and we also need to consider the social network to prevent depression and isolation. All of these situations of fragility, unless treated suitably, will lead to disability, to dependency, and ultimately to death. Let's prevent it. We will all die, but let's die in the best possible situation, right? And we're talking about loss of muscle tone and volume, but in this Congress I would like to emphasize that bone and muscle go together. The muscle is always associated with bone loss. This study shows this. In the three situations we saw, robust, prefragile, and fragile, we see that there is an exponential loss in parallel of both muscle mass and bone mass as people become impaired, turning fragile or dependent. It seemed important to me to show this study to you, a study of a pioneer. This woman demonstrated how important nutrition and exercise are to improve the quality of life of elderly people. This researcher, Maria Fiatarone, designed a study, the Boston study, in 1994. This was not the day before yesterday. In this study, they assessed 100 residents. One group was subject to exercise, the other was not, and then the results were compared. The mean age of both groups was 87 years old, an advanced age, with fragile elderly people to whom certain exercises were applied, multi-component exercises 3 days a week during 10 weeks. What did they observe at the end of the study comparing both groups? Well, they saw that in the group doing the exercise, the multi-component exercise, they improved muscle strength in 113%. This is not minor. The muscle transversal area increased in 2.7%. Gait speed improved in 11.8%, and the capacity to go up and down the stairs in 28.4%. They also observed that this was related with a suitable nutritional approach. So now you can see what I recommend, right? No drugs, no complex treatment, just an active lifestyle, exercise. And currently, with the several studies that have been made to approach fragility, we have seen how the areas that are crucial to be considered are these: exercise, multi-component exercise based on strength, muscle resistance exercises, balance, aerobic exercise, walking, strolling, and flexibility exercises. If we add to these a suitable pharmacological control, and if we add to that a suitable nutrition that should be rich in proteins, and above all, a control of vitamin D, then we can guarantee a better quality of life, moving from fragility to robustness. Now, allow me to quote this study, convinced of everything that I've been telling you. We started to design a study that was carried out together with the School of Physiotherapy of the CEU University of Valencia, and we called it the Batlle Power Project. We ourselves, and this was published in the Journal of Geriatric Physical Therapy, an American functional rehabilitation journal, this study was needed to demonstrate what I just said. We submitted a group of fragile patients to multi-component exercises on strength, balance, and gait during 24 weeks. 72 sessions, 3 a week, and 40 minutes per session. At the end of the study, we were able to significantly observe that the group that had carried out these types of exercises improved mobility, functional balance, and strength, reducing the risk of falls significantly compared to the other group of residents that were fragile, showing much greater independence to carry out daily activities, and we also saw a clear reduction in this move towards fragility and dependency. If we approached fragility as a second module of this presentation, I think it would be interesting to assess hip fractures as a paradigm of fragility and complication associated with fragile patients. Why is this important? I believe in this Congress it has been mentioned from different standpoints. Well, because elderly people frequently fall. Today, I demonstrated that. And 2% suffer a hip fracture. 50,000 new cases in Spain. Only 30% fully recover after 6 months. There's an increase of mortality. And as I mentioned earlier, since hip fractures occur in this group of fragile patients, the intra- and post-hospital complications are very high. Delirium, pain, anemia, ulcers, and as I said, 8 to 18% more chances of dying compared to those who do not suffer a hip fracture. Now, hip fracture affecting fragile patients should require a multidisciplinary approach, a comprehensive approach. In the previous panel, they mentioned how important extrinsic factors are. That is architecture, for instance, the architecture of the home, the rugs, the lighting, slippery floors, bathtubs. All of these elements predispose to fractures, and the people falling must know why they fell, how they fell, and where they fell, removing architectural barriers, as was mentioned earlier, with suitable lighting, open spaces, and suitable guiding. Not only do we need to assess extrinsic factors, those falling must also assess intrinsic factors, such as cardiovascular problems, arrhythmia, blockages, neurological complications such as Parkinson's disease, vestibular complications, or osteoarticular osteoarthritis complications. We will also assess the alterations of gait and balance. Feet in geriatrics is also a symptom. We need to review them. We need to review callus, malformations. All of these things predispose to falls, or the alteration of distal sensitivity, just to give an example. We also need to assess that people falling have what we call fear to fall again. This could even be a problem that needs to be suitably approached with psychologists. And we always need to consider drugs. Many drugs, by means of different mechanisms in elderly people, predispose to falls. They include what we call in medicine an anticholinergic effect, producing dryness in the mouth, blurry vision, tremor, constipation, and wrong bodily positions. This requires a comprehensive approach. We will assess osteoporosis, calcium and vitamin D supplements, exercise, multi-component exercise, nutritional intervention, enriched diet, rich in proteins, pharmacological intervention, review of drugs. All of those drugs that at one point or another may produce more damage than benefit should be assessed and withdrawn or seen with its dose reduced. We also need to consider sensorial deficits and pathologies. Following this multi-component approach, following this comprehensive assessment on hip fractures. We need to see under what conditions people came to our care homes or seeking rehabilitation following a hip fracture. We prepared a protocol of action and we conducted monitoring during 3 months. 80% of people who came to us also were at risk of malnutrition with associated geriatric symptoms. We saw all the problems they presented, and we also provided comprehensive rehabilitation therapy, assessing them at the end of this 3-month period. We assessed the kind of deambulation with various scales, geriatric syndromes to see if there was pain-associated constipation or ulcers by pressure, if the lesion presented complications, if there were ulcers, and we also exhaustively assessed nutrition, in addition to checking albuminum, iron levels, and vitamin D in particular. And now to conclude, after 3 months, with a comprehensive and protocolized assessment of the hip fracture approach, of those coming to seek rehabilitation in our centers following 1 year, we saw that after 3 months we could improve charge and deambulation, that is autonomy, in practically all residents who had came to us. Their ambulation was much better. The same goes for the curing of ulcers and surgical lesions, with a percentage increase in improvement of pain management, improvement in nutritional aspects. Vitamin D and anemia did not show such excellent results because it is also true that we were very much dependent on the analysis and the other processes that were not exclusively dependent on us, the care homes, but also on the external healthcare system, which delayed the impact of these analytics. But I believe the results, the outcomes were very satisfactory, and we assessed it was worthwhile to carry on working and moving forward in the care of elderly people with a comprehensive and protocolized approach. In conclusion, active life. Let's never forget about that. And above all, we need to keep good track of ingestion. As people grow old, loneliness, they could tend to forget about certain factors that are very important. Cooking food, healthy food, also protein-rich food. Fragile patients need a higher intake of proteins than young people. We need to keep this in mind because nutrition and exercise are the 2 factors that will allow us to age in a much better way. This is the conclusion of this presentation. I hope to have demonstrated to you what my message was, and I would like to thank you for your attention. Thank you very much, Doctor. Thank you, Doctor. Now, can we open mic 1, please? Thank you, colleagues. Now let's greet Maria. How are you, Maria? I'm okay. We are very glad to have you. What did you think about the doctor's presentation? How are your muscles? What does that mean? What does UI mean? They're okay. You look good. Don't you think so, doctor? Is she robust? Is she fragile? No, she's robust. But only because she's a friend of the physiotherapist in the center. She's very obedient and she does what she's told.
Please come closer to the mic so that we can properly hear you. And now, since you're talking about the physical therapist, I'm sure that you have a multidisciplinary approach, but how do you manage for nutritionists, doctors, physical therapists to be fully coordinated, to be aligned and work for the same goal? Well, this is the way we work. We always have an interdisciplinary approach. We have comprehensive teams on doctors, nursing, physical therapy, occupational therapy. So we are used to this type of approach on the one hand, and then we have some outstanding and passionate professionals. So when we started with Batlle Power, the partnership with the Seu San Pablo physical therapy experts was something that was really appreciated, and we really enjoyed it with the testing and with any conclusions that you drew in the case of the hip fractures presentation. Well, basically, as I was telling before in my presentation, that you need to have a comprehensive approach, a holistic approach into hip fracture. I'm not sure if there are any traumatologists in here, and don't mean to be disrespectful or to underestimate someone else's work. And of course, they are the most important practitioners on hip fractures. But if you only look into the hip for an elderly person, then you are only taking care of 10% of what that person needs. It's really important for an elderly to have a holistic and interdisciplinary approach. It also needs to be an early intervention. If you have that person in hospital on a Friday and they will not go surgery until Tuesday, they will have a worsening of the prognosis. And if you don't take into consideration the symptoms such as nutrition, constipation, anemia, calcium and vitamin values, cognitive stimulation, well, complications might be even worse. For how long have you been at Ballesol Barcelona home? 7 months. And what was the reason behind you going there? My husband was sick for 12 years. None of his organs would work well because of his heart. But then there came a time where I couldn't have him anymore at home because of strokes. And then my children told me, Dad can no longer be at home. He needs to go to a care home. And I thought, okay, great, but then I'm going along with him because I'm not leaving him. And first it was in Ballesol. We went to Aleya, where a daughter-in-law of mine had worked. Then my husband died some 9 months ago. And what was I to do in Aleya, since all my life I had spent in Barcelona? And then I got in touch with them. So that's a beautiful thing, noticing that you can no longer be at home, you required support. Well, we had the support, but not even with that we could manage. So you decided, okay, I'm going along with him, I'm not leaving him. And since you've been in a Ballesol home, your health, because I'm guessing that you are doing some exercise and maybe you were not doing that at home. Well, I did some. But the lady that came at our home, well, we both did exercise, but your quality of life and your life expectancy has improved. Yes, I don't look the same. Yes, I have improved significantly in just a few months. Yes indeed. How can you feel that? Because there are some external values. You're looking great, but then within, how can you express that you're feeling better? Because I feel no pain, and I used to have much pain, because my bones are in a really poor condition with many fractures. And how's your hip? It's great, perfect. That's great, that's a good start, yep. But then I see excitement in you, yes, and you look really healthy, you look really fit. We can go out tonight, I'm sure. Yes, I would. So you would go for it, great. Now, and I'm sure you've made some new friends, and your family can visit you whenever they want, you can leave whenever you want. I used to, but then I fell. Yes, we can see the result of that. I went surgery twice. And then my daughter doesn't want me to leave on my own. I need to go out accompanied. But anyway, it's okay. It's good. How many friends do you have now in the nursing home? Well, close friends? Well, on any sort of activity. Yeah, I would say that I'm a friend to everyone in there. Yes, I talk to everyone in there. Say, hi, how you doing? So, good morning. Yep. So, now that is there Yasuna, but how's really the food in there? So how's the food like? Yeah, I heard that. I heard that. Well, a couple of issues here. When you move into a nursing home and you are used to your home cooking, well, but then sometimes the cooks, well, you need to tell them, but I guess that you know what you like in your food. Yeah, high cuisine. I'm not saying it's wrong. I'm not saying it's bad food. I mean, I have to go back there, so now you're getting dessert twice tonight. I think we have some footage, a clip. Yes, let's take a look at it. Can dim down the lights, please? Thanks. Every morning I walk this hall to do my activities, either gymnastics or knitting or painting. We at Ballesol want to have an active treatment, and through our physical therapy teams we have physical activities on strength, flexibility, balancing, and then other than that it's really important to have a food that's focused on the individual to cater for their needs. And also it will be very important for the doctor to determine the pharmacology for the patient.
Don Tomás, con este aparato te vamos a medir cuál es tu fuerza muscular, ¿vale?
So, with this device we'll be measuring your muscle strength. It's called a dynamometer. The mirror therapy is being used for patients with a lack of motion in their upper limbs, be it the hand or arm, by creating an optical illusion and creating movement in the affected limb. Since I moved into Ballesol nursing home, I feel more able to walk and with a better quality of life. I feel myself young, and I'm 93. I'm 93. I walk, I run if I have to. I'm always on top of them to come and do some gymnastics, some walking. I mean, all the exercises that are done in here.
Muy bien. Pues yo agradezco al doctor Fermín García su presencia, su magnífica exposición, de verdad.
I'd like to thank Dr. Fermín García for his wonderful presentation, and to Maria for the effort done. Sorry, I did not ask you about your age. 85. But you look like less than that. I'll be back. Yes, and I will buy your...
Un fuerte abrazo.